Hey folks, welcome to the Dr. Deals podcast, where we talk about healthcare business transactions. I'm Nick Newsat from healthcontract.com. Have you or a loved one been involved in an accident? We've all seen the personal injury lawyer ads on TV. Today, I'm going to talk about the fair market value of physician fees in letters of protection. When someone gets hurt in a car crash, workplace accident, or because of negligence, there's often a dispute over who should pay for their medical treatment. Healthcare providers who agree to treat these patients under letters of protection face long delays in payment and the risk of not getting paid at all. Letters of protection are agreements that establish promises to pay for the cost of medical care using the future settlement money from legal cases involving car accidents, workplace injuries, or negligence. It's important for everyone involved in these agreements to ensure that healthcare fees are fair and balanced, taking into account market rates and the risk of medical professionals not getting paid. Injuries like bone fractures, muscle tears, or nerve damage often require specialized care from doctors like orthopedic surgeons, pain management specialists, spine surgeons, or neurosurgeons. Treatment can include hospital stays, surgery, injections, or devices like pain pumps. These costs can quickly add up and go beyond what auto insurance policies and personal funds can cover. Without fee schedules, healthcare providers typically charge their full gross charge rates under letters of protection. These rates are listed in what's called a charge master, which is like a menu of sticker prices for medical services. When patients have traditional health insurance, the actual amount paid by insurance is lower than the full charge master rate because of negotiated discounts. But under letters of protection, providers might expect to be paid their full charge master rate. Healthcare providers take on a lot of risk with letters of protection because they might not get paid for years or payment may never come. It's fair for them to charge reasonable fees as long as they're not much higher than what other providers charge for the same service. Gross charge fee schedule rates are often based on a percentage of what Medicare pays for the same service. For example, a doctor's office might set fees anywhere from 250% to 3,000% or more of the Medicare rate. The national distribution of gross charge rates for common medical services are being shown on the screen now for 5 medical and surgical specialties. Providers who often work with letters of protection should periodically check their fees against the market to make sure they're not charging too much or too little. Setting clear rate expectations for medical services in advance benefits everyone involved in letters of protection, including providers, patients, and the lawyers handling the cases. Gross fee charges for different types of physicians vary wildly nationwide. Depending on the specialty and market, office-based evaluation and management services may defensively range from 300% to 600% of Medicare. Gross fees for certain minor procedures and surgeries may range from 1,000% to 3,000% of Medicare or more. The tables being shown on the screen now compare market fee rates across the whole U.S. to the national unadjusted Medicare reimbursement rates from 2021. The tables I'm showing on the screen now do not reflect fair market value fee ranges for individual markets. Gross fee charges vary a lot among and within states. Medicare pays very different reimbursement rates for the exact same procedures in Orlando, Florida, and Omaha, Nebraska. Doctors' gross fee charges are also very different from market to market. This is Nick Newsat from healthcontract.com. Give me a call if you need a fair market value opinion for physician fees for letters of protection. And let's do some doctor deals.